Now suppose, for example, you are unfortunate and you have a fall. What is it that you can do? You're all by yourself at home and you don't know what to do. So this is the best way that you can actually help yourself to get up from that position. Okay. So the very first situation that they have told you about is prepare. Obviously, nobody is prepared to have a fall. You don't know what to do. Everybody gets scared, anxious the moment you have a fall. Everybody is in that panic mode, right? So once you have a fall, first of all, just lie there for about a couple of minutes. Take 2-3 deep breaths and accept the fact that you've had a fall, and so that you're in a position to act better once you know that you've had a fall. So then if at all you have anybody in the house, or if you've got something like an alarm or a pendant that you can press onto, that's the next immediate thing that you do. Call for help. If you know that there is no help, then this is the next thing that you will be doing, is looking for a steady piece of furniture, which can be anything, a bed, a chair, whatever that is around you. Okay, so if you look at it, it can be also the bottom of a staircase. So as simple as that. And obviously you're not going to sit up and try standing by yourself very quick that way, because you are in that panic state. You don't know what has happened to you. So it's always better to first find a steady piece of furniture. Once you do that, you always roll over to one side. The reason being, once you have a fall, obviously it leads to something called a change in your blood pressure. So you should never be sitting up straight away, because that's going to cause a sudden drop of blood pressure as soon as you sit up. So it's always better to turn onto one side and then move your shoulders, arm, hips, and finally your leg. Once you are on your side, then the next thing you're going to do is try to rise up. So you're going to push your upper body up, lift your head, and pause for a few minutes to steady yourself. Again, they are trying to focus on the point that you need to be slow in your progression. If you do anything very quickly, that is going to have an impact on your body. Okay? And the next thing you would do is, if at all that furniture is away from you, you're going to try to crawl towards that. Now, I understand not everybody is in a position to crawl, but whatever is possible, the closest piece of furniture, try to get closer to that so that you can hold on to that. Okay? And then you put your hands on it and then try to stand up or sit up on that chair. Okay? As you get closer to that, obviously the furniture, you bend your knees and you get on the chair and you sit, and after that, obviously again call for help. You do not stand up and start working again as if nothing has happened. I know nobody would do that, but most of the times we tend to ignore the symptoms that we've got there. Once you are there, once you've called for help, it can be anybody, emergency services, it can be your relatives, caretakers, whoever that is. The next thing you would do, the most important thing, is you are going to contact your primary care provider. What is that for? Is to first of all identify if you've got any kind of symptoms or if you are under any kind of danger, right? Which can be, sometimes it does happen that as we tend to age, our bones become very brittle, so we can miss out on something like as simple as a hairline fracture. Okay, you might not have symptoms, but eventually it can build up on symptoms. So you need to look for any kind of pain, any swelling that you're getting, any episodes of dizziness, nausea, vomiting. All of these are very important signs to look for if at all you have a fall. Okay, and the next thing that a primary care provider should be doing for you is doing something like a fall risk evaluation. What that means is someone who is expert in all of this should be coming home to check if at all your house is safe enough to have to prevent any of these falls in the future. Because as I said, if you have one fall, you are doubling the chance that you will have another fall in the future. Okay.